Hello, hello. Welcome to my channel. This is Dr. Ray. I am your number one gut health strategist and wellness activator. And today I'm talking about a topic that bears repeating, but so often we don't really talk about it. So, um, today we're talking about breast cancer awareness 2020. So, as October rolls around here in the US, we have our Breast Cancer Awareness Month. Or do we? You see the pink bows, you see certain sports teams wearing the pink on their uniform in some kind of way. The keychains are sold, the mugs are sold. But what are we really doing to make certain that women understand breast cancer and how they can empower themselves? So, this is what I'm hoping to do with this video today. If you've subscribed before, thank you. Please like and share this video. And if you haven't subscribed, please subscribe and turn on your notifications. So when I have a new video, you will know. So why do we care about breast cancer? Well, a few reasons we care about breast cancer. Because 1 in 8 women over the course of their lifetime will get a diagnosis or may get a diagnosis of breast cancer. For this year, 2020, it's estimated over 276,000 women will get a diagnosis of invasive breast cancer, while 48,000 women will get a diagnosis of non-invasive breast cancer. What does that mean? So invasive means that not only is it in the breast tissue, that it's going to go other places. Okay, so that's what we think about most commonly when we think about breast cancer. 48,000 women will have in situ, which is the non-invasive we were talking about. So it might be in the breast ducts, but it's usually not going anywhere. However, it's still cancer. So cancer can cause issues even if it's in a low, in situ. What other things do we know as far as breast cancer? Well, other than skin cancer, breast cancer is one of the most commonly diagnosed cancers. But this is a thing. Even though incidence rates, so incidence is the number of occurrences of people per 100 people. Okay, so in this case, the number of cases of people per 100 women. So we know amongst Caucasian women, African American women, the incidence rates are actually not that different. However, African American women have much higher rates, death rates, when they get a diagnosis of breast cancer. The exception to that would be the Ashkenazi Jewish community, where their women do have higher rates, and it's because of the genetic mutation BRCA. What do we know that we can do to help us as far as breast cancer awareness? There's some things that we can modify and other things we can't do anything about. So gender, there are a lot more women who are diagnosed, if there is a diagnosis of breast cancer. There's a lot more women who get breast cancer than men, but there are some men who get breast cancer. Another thing that we know, genetics. Genetics can play a role. As we just mentioned with Ashkenazi Jewish women, they have a higher rate because of the BRCA gene, the BRCA gene. However, did you know how many women who go on to a diagnosis of breast cancer actually have a family history of breast cancer? I had breast cancer about 10 years ago. My mom had breast cancer the year before I did, but ours were not genetically related. We're genetically related, but our cancers were not. And we know that because cytology was done. But only 15%, and some sources will say 12%, of women who have diagnosis of breast cancer actually have a family history. So about 85, 87% of women who get a diagnosis don't have a family history. But for those who do have a family history, it doubles their risk. Okay, so that's a risk factor. We talked about gender, we talked about genetics. What's some other things? We know that certain things that can damage DNA can increase our risk of breast cancer. They're also starting to look at certain types of food, especially chemicals in food and chemicals in our environment that then push higher rates and then death rates with breast cancer. Being a breast cancer survivor myself, early detection was key for me, and early detection can save lives. So there's a couple of tools that I use that I want to explain in this video as to something that you might want to consider that could help you or someone you know. And the good thing about it is we have a promotional right now. So I'll let you know I am an affiliate for this, but it's one of the best things I've ever seen. I've never seen anything like it. So this is called a breast check kit. Okay. It is a patented device. It is a product by Plexus. This is actually one of the first products they ever did because Plexus, even though we're a health and happiness company, we started as a breast health company. Okay. And I'm going to go through how to use this and what's contained in this kit. And there will be a link below to get information on getting your own breast check kit. And like I said, we're having a promotional on that. The other thing that I have is the body cream. It's called the body cream now. When it first was released some years ago, over a decade ago, it was called the breast cream. Yeah. But anyway, the breast health cream. And then because it's such a good moisturizing emollient lotion, women who would have this in the household for themselves, you know what we do. You know what we do. They got this rash, they got the other rash, we got whatever, and we start using it for everybody. So they put it in a bigger bottle. Okay, and I'm going to go over that too. So early detection can save lives. So this is a patented medical device. It is, it enhances your performance of your monthly breast exam by acting like a magnifier. Can you see that? Acting as a magnifier for your fingertips. So I just want to let you all know, in case anyone is sensitive about a woman demonstrating a breast exam, you might not want to watch the rest of this video because that's what I'm about to do. So just a little word to the wise. So right now, like I said, we're having a promotional on this. I don't know if you can see that faded stuff. I need to take that off actually. These were $34.95 each. Now they are buy one, get one, and it's $19.95. So make certain to click that link below if you want to take advantage. See, that's why I didn't take it off, because it's ripping up my box. If you want to do the buy one, get one, it's $19.95 right now. So we're hoping to get lots of women with this device in their hands. So the first thing that you want to pay attention to is the directions for use. Okay, the directions for use, because everybody matters. This is it shows you the description of the breast check aid. And now this is an older one, so the books might look a little bit different. I'm going to show you the rest of this book and show you this part here. So here at the back of this little book is your log, your monthly log to do your exam. This is a demo. Okay, this is a demo one that I keep, so it doesn't have any notes for mine. This is what the kit looks like. It comes in this pack, and you want to keep it in this pack so it can stay protected. You want to make certain that it is dry, not kept at extremes of temperature, so not too cold, not too hot. You want to make certain that after you use it, you wipe it with a soft cloth, and you put it back inside of this bag. This is what it looks like. See that? It's got a paddle up here. Now I'm going to rub my hands. You hear that? That's just me rubbing my hands. Now this is what it sounds like using the kit. You hear that? And I'm actually able to move my fingertips a little bit more. One thing that you will see in this little booklet, and I'm going to go over that now, is here. It's actually on page 8. Page 8? Yeah, page 8. It's on page 8. Warnings and precautions, just, little FYI, the breast check kit aid makes no claim to find breast cancer, breast lumps, or other breast disease, and it should be used in conjunction with regular clinical breast examinations and mammograms as advised by your physician. Women with breast implants or constructive surgery should consult their physician before using this product. So, has a handle like this, okay? So you want to, it says breast check kit here. Well, it says breast check. And then the butterfly here. I love the butterfly. That was my symbol as I went through breast cancer treatment. So the first thing you want to do is take this paddle, this little mini paddle up here, and put it on your collarbone. And you want to very smoothly go through that tissue without losing any area. So you don't want to up in here and here. No, slide. You slide. And you're pressing down at the same time. The best position to do your monthly breast exam is going to be laying down. One, it's going to give you the full exposure of the breast, and it's going to allow that breast tissue, and especially for women who are larger breast, it's going to allow that breast tissue to kind of spread a little bit. Yeah, so you thought that was a horrible thing, that when your breasts, you lay down and they do. No, it's a good thing, girl. It's a good thing. So you're going to put that paddle up here, and you are going to feel all through this aid the breast tissue underneath. Don't do this. Don't do that. Don't do that. I would hope you wouldn't do that, okay? And you can go in a circular motion or you can go zigzag, and that is in the book with the directions for use. So after you do that first section, you want to make certain also to get up like in your armpit, okay? Get up in your armpit. There's a little bit of breast tissue there. Then you want to come down like 2-3 inches. Make certain you're getting all of the middle, all of the underside, all of the rest of the breast tissue, okay? And you want to feel it through here. You might not be familiar with this, but some years ago when this was first launched, it was on the Doctor's TV show. You might not even remember the Doctor's TV show. But it was on there. And what they did is they did a little small mock demonstration of them trying to feel for a grain of rice and how much this magnified their ability to feel that grain of rice while there was something over top of it. So it's like a simulation of a breast exam, a very basic simulation of a breast exam, but a simulation nonetheless. So this is the breast check kit aid. It's got the book. Sorry if that's so loud. It's got the book enclosed, the directions for use. And right now it's buy one, get one. So you get 2 of these. You get 2 of these for $19.95. Now I was telling you about our body cream. Right here. It works wonderfully all over the body, externally all over the body, but it works very nicely for your breast health, your breast care. And we should be taking care of our breast. They shouldn't be something that we just lug into a bra and curse underwire and stuff. We should actually be taking care of our breast. And this is one of the things that you can do to take care of your breast. If you're interested in more information in regards to breast cancer risk factors, as well as a booklet of things that you need to know, I'm putting that link in the description, so make certain to look there. I also will have a link for those who want more information about the breast check aid. And in that link, when we have products that are bought, we are going to donate another kit. So it's almost like in a raffle. So we'll have that in a raffle. So make certain to get your kit before the 31st of the month so that I can do the raffle and donate some of these. Okay. So I can donate some of these. And the body cream, as we're talking about, this is the body cream. It is a detoxifier. It contains activated charcoal and spirulina. So the activated charcoal is what gives it that weird gray color, but that weird gray color is your friend. Okay. So it goes on very smoothly. Like I said, it helps with detoxification. As you do this, it'll change colors a little bit, but it goes in the skin very easily. It's not greasy. I know some people are like, I don't like lotion because it's greasy. It is quite hydrating, moisturizing, but it's not greasy. It's not greasy at all. So you would want to use that specifically on your breast on a regular basis. So using this once a month, using this regularly, breast care in 2 steps. Super, super easy. If you have questions in regards to the product, please email me. My email is in my channel pick, and also too on that link in the bio. Also too, there will be a link in the bio for breast cancer risk factors and rates, as well as the e-booklet. So make certain to look for those things in the description below. Thank you for joining me on this video. Make certain that you look at the links, click on the link. And like I said, there's another YouTuber. She did a video about 2 years ago talking about breast massage. So I'm putting that link in the description as well, because it would be wonderful. She didn't endorse this, it's me. Wonderfully done with your body cream. It would be awesome. It would be really, really good. So thank you for joining me on my video. Make certain to like, share, subscribe, turn on the notifications. So when there's a new video, you get it. All right. Thanks so much. See you next time.